Aloha and welcome to our presentation on characteristics of central sleep apnea in Hawaii ethnic groups. Our group members are Anna, Sarah, and Michael presenting on behalf of our team. CSA is a sleeping disorder in which the brain sends improper signals to the muscles responsible for breathing. As CSA is an uncommon and complex sleeping disorder, a better understanding of various socio-demographic and biological risk factors for CSA is warranted, especially in underrepresented and at-risk populations. This pilot study investigates factors associated with CSA amongst patients of different racial and cultural backgrounds, with a focus on those of Asian, Native Hawaiian, and Pacific Islander ancestry.
A retrospective case control study was conducted at Hawaii Pacific Neuroscience Clinic. Sociodemographic, cardiovascular, psychiatric, and neurological comorbidities were collected from 35 patients with CSA. Patients below the age of 18 were excluded. Two sets of randomized, matched, and unmatched controls were collected in a 4:1 ratio.
Patients with CSA are 2.46 times more likely to have private insurance than patients without. Patients with CSA were found to have greater BMIs than patients without, with a mean difference of 3.98. Biological variables that were found to be significant included atrial fibrillation, hypercholesterolemia, autoimmune disorder, periodic limb movement syndrome, and insomnia. CSA patients were 3.6 times more likely to have atrial fibrillation than matched controls, 3.6 times more likely to have hypercholesterolemia, and 3.55 times more likely to have insomnia. Patients with CSA were 20.34 times more likely to have periodic limb movement syndrome than matched controls, and 6.43 times more likely to have an autoimmune disorder.
And in terms of the future directions of our project, we would like to expand the study to include CSA patients from other hospital systems and clinics, as well as examine other variables that may play a role in CSA in ethnically diverse groups. Thank you so much for listening to our presentation.